several rankings. Imagine that. Not only in Virginia, in the nation. And she's a CEO of it. That's pretty cool. She's also the vice chair of the Virginia Hospital and Healthcare Association Board of Directors, who are so gracious in inviting me here today. She started her career in nursing and worked her way in a hospital administration. Welcome back, Mary.
Thank you for having me this morning, John. I'm delighted to be here.
It's always great when I have someone remotely over the phone to put a name with a face, because I know there's sometimes I don't go and look up the pictures or whatever. So you say, okay, you're talking to somebody, and there's a lot of people. This is amazing, Mary. In my business, the number of people have on. There's a number of people that I have relationships with that are strictly on the air. Like, I've never met them. I've never actually had a personal conversation with them other than on the air, but I know all about their families, their children, everything else. So it's always neat to do that. Now, we're live today from the Virginia Hospital and Healthcare Association's 89th annual meeting in the western mountainous region of the state, Bath County. Beautiful area, a rural community. Now, Mary, you know a little something about providing health care in a non-dense density area, leading a rural hospital. Tell us about some of your experiences, Mary.
Well, providing health care to a community in rural Virginia is very rewarding. I feel like I have the best job in the world, but I can tell you it's not without challenges. Augusta Health is the largest employer in our region. We have approximately 2,400 employees, 255 members on our medical staff. We treat more than 500,000 patients a year on an outpatient basis, about 12,000 patients on an inpatient basis annually. And we've been very fortunate to have the financial flexibility to continue to grow, develop, be responsive to our community, expand our service offerings in areas like cardiology, oncology, urgent care services, but not every rural hospital has been as fortunate as Augusta Health. We have approximately 37 rural hospitals in Virginia. 17 of those 37, John, almost 50%, operate at a loss. They operate in the red. And recently this was affirmed by the fact checkers at the Richmond Times-Dispatch, and they said actually that the numbers may even be worse than the 17 of the 37. Virginia has already had one rural hospital in Southwest Virginia close. Nationally, across the country, dozens of rural hospitals have shut down in the past several years, and hundreds more are in jeopardy. And the reasons for this distress are multiple. First of all, our reimbursements for Medicare and Medicaid are dwindling. We get about 90 cents on the dollar of cost for every Medicare patient we take care of.
Wait, of cost?
Of cost. So we do not recover our costs whenever we treat Medicare patients.
So I just want to reiterate this. So when a Medicare patient comes in and they get whatever they need done, you're losing 10 cents on every dollar of pure cost.
That's correct.
So every time somebody comes in the door with Medicaid, you're losing money.
And it doesn't stop there. Medicaid patients, 66 cents reimbursed on every $1 of cost. So again, these payments don't cover the hospital's cost for providing care. On average, about 74% of inpatient admissions in rural Virginia hospitals are for Medicare, Medicaid, or uninsured people.
Which means indigent
care.
They just go to the emergency room, you take care of them, they get released, you get no money.
That's right. And so I don't know many businesses that can be going concern when 74% of their reimbursement is either below
Mary,
cost.
let me get this straight. So a rural hospital like yours, 74% of who comes in the door is either Medicaid, Medicare, or indigent care.
Actually, at Augusta Health, as I mentioned previously, we have a little bit more financial flexibility, and we've been fortunate in that for us that number is 64%. But for the majority of rural hospitals in Virginia, on average, 74%.
Okay, so I want to drill this down so our audience really grasps what's going on, because these are real numbers, right?
These are real numbers.
Rural hospital average in Virginia, 74%. Or 7.5 out of every 10 people that go in, either Medicaid, Medicare, or indigent care, which means they go to the emergency room, they don't have anything.
That's correct.
Right? So you're funding and on Medicare, every person that comes in, you lose 10 cents on a dollar. They're only and Medicaid is only reimbursing 66 cents on a dollar.
That's correct.
And everybody that goes in without insurance, you lose all the money because you don't get anything.
That's right. And in addition to that, there are federal laws that require hospitals to provide emergency department care to people who can't afford the payment. We have to, and it's the humane thing to do, we have to accept patients and treat and stabilize them, and it cannot be related to their ability to pay.
Sure, you're not going to turn them away.
That's correct.
If somebody comes into the emergency room and they've got an issue, you got to take them in and stabilize them and do what you can. Even if they have no insurance, no means to pay, you're going to send them a bill or whatever. They're not going to pay it, and that's it. That's called indigent care, and that's real.
That's real.
And people that don't have coverage utilize that. I mean, I hate to say this, but loophole, if you will, in the system in order to take advantage of that because they have no other option, I suppose. But that means that only 25% or 26% of people that actually go into these hospitals are paying anything.
That's correct.
Or paying 100% of how your structure's set up.
Well, typically the patients that you're describing are insurance. They have commercial insurance.
Right.
And then we have contracts with those insurance companies, and that's how we get reimbursed. So, having a viable organization economically is a challenge in this environment.
Wow, yeah, it sure is.
And I don't think sometimes the general public appreciates how heavily regulated healthcare is through a lot of these rules and regulations and government interventions.
Let me draw an analogy. That would be like on my radio program in Virginia, only 25% of the available advertising inventory that I have, actually I have customers that are paying the rate, okay? And then the other 75% is either free or I actually lose money every time somebody puts an ad on. I mean, I would survive about a week.
It's a tough business model.
I would be out of business by the end of the month.
And it doesn't stop there because then with the Affordable Care Act and sequestration, and Virginia has not expanded coverage, hospitals are getting it on all sides, definitely being assailed on all sides.
What a nightmare.
It is. It's a tough environment to be in. Definitely a tough environment to be in.
Jeez, I mean, it's mind-boggling. The discussion on these economics really brings up this. Hospitals are a business which happen to provide vital health care services. Now, I think people lose sight of that sometimes. We just went over these numbers, which are just horrific for rural hospitals. We all take for granted that the hospital's going to be open, it's going to be there, it's going to be accessible when we need care or a loved one needs care, etc. But that expectation overlooks the financial realities that confront rural hospitals today, and the interventionist, did I say that right? The intervening role that government plays in healthcare. Now, how do you communicate that in a way that people can just grasp?
Well, you have to reduce it to its fundamental elements. Conversations like what we're having right now. You just said something very interesting, that hospitals, that you do have to run them like a business in order to be sustainable. There are some people that are very offended about looking at a hospital as a business and understanding that that has to have a tenable business model or a tenable economic model in order to be able to fund our mission to improve the health of the community. But it's a reality, and it's a reality that people like myself or any CEO or board in the country need to be very concerned with. And so having these kinds of conversations are very important so that the community is aware, they get engaged, and they partner with us to help us be strong for many generations to come. Community hospital is really the cornerstone of a community. It needs to be there in a reliable fashion. We need to provide safe, high-quality care. Typically, we're the largest employers, as is Augusta Health in the region. 1 out of every 9 jobs in Virginia is in a healthcare organization. We employ 115,000 people across the Commonwealth. Not only is it a service that every community needs, but we have a significant impact on the economy of our local communities and across the Commonwealth of Virginia.
Mary, I have to say you're a great radio interview because you're very succinct and salient. I want to tell you that. By the way, we're with Mary Mannix. She's the president and CEO of Augusta Health in the Shenandoah Valley. She's also a vice chair of the Virginia Hospital and Healthcare Association's Board of Directors, where we are today. Mary, look, we can talk about these numbers. They're stunning. I want to keep saying them because sometimes it just takes people a while to grasp what's happening. We have an impasse in Virginia. We have a Democratic governor and some Democratic members of the General Assembly that think solving this problem is through expanding Medicaid. We have a conservative supermajority in the House of Delegates led by Speaker Howell that is not going to allow this to happen. We also have a majority of conservatives now in the state Senate of Virginia that have no interest in expanding Medicaid. So it isn't going to happen. It's just, to me, this is now nothing more than a theoretical debate to have in a college class. It isn't going to happen. So what are other alternatives? What else can the General Assembly do? What can they come up with to fix this problem that don't include the political hot button of expanding Medicaid?
It's a great question, and I wish I had the answer for it. We don't know what's going to happen on a day-to-day basis. Last year, we advocated very heavily for expanded coverage for Virginians. We think it's important to the health of Virginians. We think it's important to the economy to have healthy workers, and we think that hospitals, again, are also very strong contributors to the economy. It's not a tenable economic model in the long run, and it concerns us greatly. And, I think it's also important not to attack hospitals on other fronts as well, such as Certificate of Public Need, which is out there right now. That's going to be a hot topic in the 2016 General Assembly. Hospitals cannot continue to take it from all sides and continue to fulfill their mission, do it well, and do the right thing by their communities.
I've got 2 more minutes to just elaborate a little bit on the Certificate of Need.
So Certificate of Need regulates certain services and technologies. There's actually a required approval and review process that any hospital or health system or provider has to go through in order to start up a new service. There are specific trigger points that allow it to be a reviewable technology or service. And the objective here is to decrease the cost of care and make sure that we don't have unnecessary duplication and make sure that we're meeting specific quality standards so the care is safe and high quality. Additionally, it does provide a protection to hospitals that provide charity care that are in this conundrum of the economic model that I just shared with you. And that's primarily not-for-profit hospitals. And basically what it does is it doesn't allow somebody else to come into the market, duplicate a service, and cherry pick out those services that do have a positive operating margin or those services that are going to be reimbursed by those commercial insurers.
So, Mary, to just sum it up, you've got a hospital in a rural area that's providing a range of services, charitable services. They're making money on some, losing a lot of money on others. You get another provider that comes in and says, well, I'm going to provide any of the charitable stuff. I'm not going to provide any of the non-profitable stuff. I'm just going to pick these 5 things that I know that I can make a profit on, and I'm going to undercut the hospital that's there a little bit. I'll make a lot of money, but then everything else suffers because the whole system implodes, right?
That's right, and the hospital has a disproportionate amount of indigent care and care that's provided at a loss but is still needed by the community, safety net care, behavioral health, those types of services.
Mary, I appreciate your sharing your perspective, Mary Mannix. Tell people again where they can learn more about the importance of hospitals and the challenges they face.
Go to isupportvirginiahospitals.com. All that information is readily available, easy to read, and thank you.
Thanks for being with us, Mary. That's a wrap. Live, the 89th annual meeting of the Virginia Hospital and Healthcare Association. This